Hello friends, let's discuss an antihypertensive class angiotensin receptor blockers or ARBs. Drugs like Telmisartan, Losartan and Valsartan belongs to this antihypertensive class. Let's see how these ARBs work in a body to reduce the blood pressure. Before we understand the mode of action the ARB works, we shall have a little idea about the RAS system. How does this RAS system maintain the blood pressure in our body? Whenever your blood pressure or a blood volume declines, the pressure towards the kidney reduces. It is immediately sensed by the kidney, and a specialized cells of a kidney named juxtaglomerular cells or a JG cells become active. Friends, we have to remember one thing. The whole intent of activating a RAS pathway is to increase the blood pressure. Now, as I said, whenever the blood pressure or a blood volume declines, the JG cells of a kidney become active and it starts releasing a substance named renin. Before we understand the role of renin, we need to understand about angiotensinogen, a substance which is produced by the liver which is present in a blood before renin came in. Now, angiotensinogen is already there within the blood produced by the liver. Once renin comes in, the renin goes to the angiotensinogen and it cleaves the angiotensinogen to make angiotensin 1. You can see this angiotensin 1 again is worked upon by the enzyme produced from the lungs. The name of that enzyme is ACE, angiotensin converting enzyme. With the angiotensin converting enzyme, angiotensin 1 converts to angiotensin 2. This is how the angiotensin 2 is produced. What is the role of angiotensin 2? Angiotensin 2 increases the blood pressure. The question is how? Angiotensin 2 binds with angiotensin receptor type 1 or AT1 receptor. These receptors are present on the adrenal gland, the gland which is present above the kidney. Angiotensin 2 binds with AT1 receptor. On binding with the AT1 receptor, the receptors become active. Activation of this receptor leads to the production of mineralocorticoids named aldosterone. This aldosterone is responsible for putting more water and the sodium within a blood from the kidney. So, blood volume increases since the sodium and water both will increase the blood volume. Since the blood volume increases, the blood pressure also increases. This is how the activation of a RAS pathway has increased the blood volume and the blood pressure. Activation of a RAS pathway does not increase the blood pressure by one way. This angiotensin 2 also bind with the AT1 receptor present on the blood vessels. Once AT1 receptor become active on the blood vessel, it leads to strong vasoconstriction. Since there is a vasoconstriction leads to increase in the blood pressure. Again, the blood pressure has gone up. The same angiotensin 2 also binds with the AT1 receptors on the brain and activates the AT1 receptor, leads to activation of SNS, that is sympathetic nervous system, ultimately increases the blood pressure. So, in summary, if you will see, the angiotensin 2 binds with AT1 receptor at the various locations of the body and increases the blood pressure. Activation of AT1 on the adrenal gland increases the blood pressure. Same way, activation of AT1 on the blood vessel through the vasoconstriction increases the BP, and activation of AT1 on the brain increase the blood pressure by activation of SNS. In summary, activation of a RAS increases the blood pressure. So, this normally happens in every one of us, whether the patient is hypertensive or not hypertensive. So, RAS system remains active in every individual. Now, what is the problem been found in a hypertensive patient? In a hypertensive patient, it has been found that RAS is hyperactive. So when I say RAS is hyperactive, what does this mean? Hyperactive RAS means your RAS will become active even without substantial decline of a blood pressure. It keeps remain activated. So continued activation of a RAS pathway leads to continuous increase in a blood pressure. This is how overactivation or a hyperactivation of a RAS pathway results in high blood pressure or a hypertension in hypertensive patients. So, suppressing a RAS pathway is one of the fundamentally considered therapy for controlling the blood pressure. To control the RAS pathway, we are introducing Telmisartan, Valsartan or Losartan or any other ARB. This ARBs, Angiotensin Receptor Blockers, goes and block the AT1 receptor, that is Angiotensin Receptor type 1. Once AT1 receptor is blocked by the ARB, no angiotensin 2 can bind with it. Since no angiotensin 2 can bind with it, no activation of AT1 takes place. In the absence of AT1, there is no increase in the blood pressure. This is how Telmisartan or any other ARB blocks the RAS pathway by blocking AT1 receptor. So they are named AT1 receptor antagonist or AT1 receptor blockers. Thanks for watching. If you like it, please share and subscribe.